Good evening, and welcome to the Ellen L. Stovall Awards for Innovation in Patient-Centered Cancer Care. I'm Shelley Fuld, Nasso, CEO of the National Coalition for Cancer Survivorship, and I want to thank you for joining us tonight to celebrate the work of two outstanding individuals, Dr. Deborah Mayer and Kimberly Richardson. We look forward to next year when we hope to be in person again at the Four Seasons in Washington, D.C. I want to take a moment to thank those who made tonight possible. ASCO has been an incredible partner, and we are proud that they are co-presenters of the Provider Award again this year. Thank you to our platinum sponsor, Janssen Oncology and Pharmacyclics. I am grateful to all of our sponsors and donors tonight who continue to lend their support to this program and to NCCS. This event would not be possible without you. Your contributions help us carry on Ellen's legacy, and for that, we are deeply grateful. I want to thank Dr. Douglas Blaney, our inaugural Stovall Award winner and chair of our selection committee. His vision for this award and integrity in leading the process is inspiring. We're grateful to our selection committee members who lend their time and talents to the selection process. Once again, we had an incredible group of nominees this year, and choosing our winners from such a talented and accomplished group continues to be a wonderful challenge. I also want to thank our honorary Congressional Host Committee for recognizing the importance of cancer survivorship by lending their support to this event. Thank you to our dedicated board of directors for their leadership and commitment to NCCS. We are grateful to Ellen's family who continues to support NCCS, especially her cousin Laurie Isenberg, who serves on our board and whom you will hear from later tonight. In January, it will be 6 years since we lost Ellen. It's hard to believe that it's been that long. She continues to be always in our thoughts, guiding our work, and we continue to strive every day to live up to her legacy. Ellen knew Dr. Mayer well, and I believe she would be thrilled to see her recognized with an award in her name. While Ellen did not have the opportunity to meet Ms. Richardson, Kimberly truly embodies Ellen's spirit, a woman who was blindsided by cancer, but turned that experience into a way to improve care for cancer patients and their families. Finally, I want to recognize the cancer care providers across the country who have continued to take care of people living with cancer through this pandemic. They have innovated in how they deliver cancer care and made heroic efforts to keep cancer patients safe while receiving their treatments. Cancer doesn't stop during a pandemic, and cancer care professionals did not stop either. On behalf of cancer patients and their families, thank you. Thank you again for joining us, and I hope you enjoy the program.
ASCO is excited to continue our close relationship with NCCS, including in our involvement in co-presenting the Stovall Awards. And tonight, I'm especially pleased to be with you as we recognize two outstanding individuals with remarkable contributions to the field of cancer care and advocacy, Dr. Deborah Mayer and Kimberly Richardson. These individuals share with all of us at ASCO a firsthand knowledge and appreciation for the importance of providing patient-centered care, and we are privileged to be able to honor them for their work in this area. To be clear, this effort is near and dear to our hearts every day in everything we do at ASCO, where we strive to support the delivery of equitable, high-quality care through research, education, and support for clinicians. Please join me in congratulating tonight's awardees for their remarkable contributions.
I'm pleased to introduce Dr. Deborah Mayer, recipient of the Ellen Stovall Award for Innovation in Patient-Centered Cancer Care. Dr. Mayer began her career when she received her diploma in nursing from the Pennsylvania Hospital School of Nursing. She worked in OBGYN, mostly in the neonatal unit, for 2 years after graduation and dreamed of being a pediatric nurse practitioner. That changed when she heard about a medical oncologist who was looking for a chemotherapy nurse, and it didn't require shift work. Although she had no cancer or chemotherapy knowledge, she obviously interviewed well, and she got the job. The oncology nursing specialty and ONS specifically have benefited from this early pivot in her career. Dr. Mayer advanced her education and received bachelor's and master's degree, her nurse practitioner certificate, and her PhD. Concurrently, she established herself as a leader in oncology nursing. She is a founding member and the fourth president of the Oncology Nursing Society. She was the first nurse on the NCI's National Cancer Advisory Board and the only nurse to be appointed to then Vice President's Cancer Moonshot Blue Ribbon panel. Her volunteer leadership has been extensive in ONS and also in ASCO, where she served as chair of the ASCO Survivorship Committee. Her commitment to improving cancer care can be seen in her publications. More than 200 articles, book chapters, and editorials on cancer-related issues. She served as the editor of the Clinical Journal of Oncology Nursing, mentoring many first-time authors. She is internationally known for her work in cancer survivorship and was the interim director for the Office of Cancer Survivorship at NCI. She's received numerous awards, including the ONS Lifetime Achievement Award, and is a fellow in the American Academy of Nursing. Throughout her career, including in her faculty positions, Dr. Mayer has worked on the front line with cancer survivors, most recently at the University of North Carolina's Lineberger Cancer Center. I could say much more about Deb as a colleague, mentor, confidant, and friend to so many, not only in oncology nursing, but across the cancer care landscape. Congratulations, Deb, on receiving this prestigious award.
Dr. Deborah Mayer recently retired from the University of North Carolina Lineberger Comprehensive Cancer Center after an illustrious 45-year career. She has held many prestigious positions, including Director of Cancer Survivorship and Professor of Nursing at UNC, President of the Oncology Nursing Society, and Interim Director of the Office of Cancer Survivorship at the National Cancer Institute. Dr. Mayer was also the only nurse appointed to then Vice President Biden's Cancer Moonshot Blue Ribbon panel. Deb brought years of experience and insight to her work as an advanced practice oncology nurse, as well as her own unique perspective as a cancer survivor. Her body of work in the field of cancer survivorship as a nurse, researcher, teacher, mentor, and advocate will continue to improve the lives of cancer survivors and oncology professionals for years to come.
She has been so talented and accomplished in multiple spheres. There's some rare people that are really on top of cancer policy. And there are other people that are just spectacular clinicians, and other people who are educators, and some who are researchers, others who are really good writers or editors. Deb is able to kind of operate beautifully in each of those spheres. Deb's influence in the survivorship world, kind of nationally, internationally, is undeniable. But I can also tell you that she has been incredibly effective at the local level at the University of North Carolina. So in her time as the director of cancer survivorship here, she was able to organize and put on really extraordinary annual programs for survivorship for patients and family members. She was able to adapt, modify in really important ways the cancer transitions program that she ran here. She had a survivorship clinic in the breast group that was, I think, really very effective and complementary to the primary medical oncology care that went on. And what I really loved about her influence in the survivorship world at University of North Carolina is that she engaged primary oncologists to think very differently about survivorship care than they had before she was here.
Deb's role as a teacher and a mentor has shaped many careers. She has trained more than 75 nurse practitioners and guided the careers of countless others, always encouraging her students to challenge themselves and pass the torch by mentoring others.
She has the passion. She's worked clinically for 40 plus years. And so I think as she's educating us and mentoring us, she's also thinking about her clinical practice and the situation that she might have had with some of the patients she's cared for. And so that's what makes it very special to me, is that she's just not talking the talk, but she's walking the walk with a clinical practice and really bringing in, this is what I'm seeing in clinical, and this is what may be in the book, but let's think about how do we marry both of them and say, this is what current evidence supports. So I think that's just who she is. I mean, she's a mentor at heart and a lifelong learner. She's really humbled herself to say, how can I ensure that the current and next generation have what they need to be successful? But more importantly, how can I ensure that they have the resources and support to ensure that we are really taking really good care of individuals with cancer and their caregivers?
Jean Mosley and Deb have known each other for more than 40 years, both oncology nurses who met through their involvement in the Oncology Nursing Society. The two stayed connected over the years as both professional colleagues and personal friends. After a career of caring for cancer patients, last year Jean became a cancer patient herself when she was diagnosed with angiosarcoma.
I was well aware of the severity of this diagnosis and the challenge of the treatments ahead for me. As soon as I walked out of that office, my first phone call was to Dr. Mayer to let her know about the clinical diagnosis. And she became my personal advocate and my very extraordinary friend. I am very grateful to have had her walk this road with me over the last 18 months. You can recognize the professional value of a colleague or a friend by the papers they write, by the awards they win, by the publicity that they receive based on their outstanding academic work. But I was really struck by the tenacity of Deb Mayer as my patient advocate and the person walking right beside me, step by step. Because of the pandemic and because of the frequent need to receive cancer care, it was not possible for Deb to be here with me for those sessions, but she was always available and has attended every single one of my appointments with me by FaceTime, with the exception of radiation therapy. She was my own personal PhD oncology nurse who specializes in survivorship. So what could be better? I was just very blessed to have her with me and look forward to her continuing to support me as we continue down this road.
Hello, I'm David Price, representing North Carolina's 4th Congressional District. I'm honored today to join the National Coalition for Cancer Survivorship as we honor this year's recipient of the Ellen L. Stovall Healthcare Provider Award, Dr. Deborah K. Mayer. Dr. Mayer is a leader in cancer survivorship, having dedicated her career to patients and their families, and I'm very, very proud to be her representative in Congress. I, along with my staff, have fond memories of our many meetings with Dr. Mayer over the years, constituent meetings that we've taken. Her dedication, her impact as a nurse, researcher, teacher, leader, and advocate are evident in the testimony from the patients and families she's worked with over the years. She's a breast cancer survivor herself. So Dr. Mayer understands the difficult journey undertaken by cancer patients and their families. She's developed close relationships with her patients, providing them support beyond their diagnosis and teaching them the importance of patient-centered care. She also respects and welcomes the perspective of her students and her mentors in research and clinical care, and will undoubtedly leave behind her a legacy of collaboration and collegiality and unwavering care at the University of North Carolina and the oncology nursing world. So throughout her distinguished career of 45 years, Dr. Mayer has helped transform the cancer care system. So thank you, Dr. Mayer, for contributing your knowledge and your time and your care to the fields of nursing, public health, science, and medicine. Your passion for your work and for advancing cancer survivorship care embodies the spirit of the Ellen L. Stovall Award. You richly deserve it. And it's my honor to present you with this prestigious recognition. Congratulations again.
Thank you, Brenda and Representative Price, for your kind words. Receiving the Ellen Stovall Award is the highlight of my career as an oncology nurse. I want to thank the National Coalition for Cancer Survivorship for selecting me, along with Kimberly Richardson, and for acknowledging previous recipients who've been leaders in survivorship care. I also want to thank my colleagues, Doctors Ashley Bryant, Donald Rosenstein, and Sophia Smith, as well as Jean Mosley, for nominating me. It truly is a special recognition. I began my career in oncology in the mid-1970s as a chemotherapy nurse. In those days, there were no words for survivorship or financial toxicity or later long-term effects. That was because few people lived long enough after their diagnosis. Cancer diagnosis is a word that was whispered, if spoken at all, at that time. This represented about 1% of the US population. We were learning as we took care of people with cancer. Fast forward almost 50 years and much has changed. There are now over 17 million survivors, representing about 5% of the US population. We're preventing some cancers while finding others earlier when treatment is more effective. Our investment in new treatments and clinical trials has led to more people who are living with and beyond their cancer diagnosis. They are living now long enough to experience that financial toxicity and those long-term and late effects, including getting other cancers. One of my first patients taught me about what was important to know as an oncology nurse. She had advanced cancer and told me that she expected her doctors to cure her if that was possible or to control it if it wasn't. But she went on to say she needed us also to focus on whether she had been able to sleep, whether her pain was controlled, or what she was able to do at work to make her life worth living. She introduced me to the concepts of quality of life and symptom management, and to look at her as a whole person. All my patients have taught me lessons about what mattered to them and how to take care of them as I learned to be a better listener. This reminded me of a quote from Sir William Osler, who helped found Johns Hopkins Hospital in 1889. He introduced clinical experiences as part of medical training and insisted that students learn from seeing and talking to patients. He said the good physician treats the disease, while the great physician treats the patient with the disease. Like Osler, Ellen Stovall wanted others to learn from the experiences of people with cancer like her. Her advocacy as CEO of NCCS led to the development of the National Cancer Institute's Office of Cancer Survivorship. She and I served together on the NCI's National Cancer Advisory Board in the 1990s. Many years later, I became interim director of that office. Over the years, her steadfast and insistent voice made all of us see the person who has the cancer, not just focusing on treating the cancer. And the work of NCCS has continued by learning more and sharing from all those who are touched by cancer. And we have learned much, mostly that having cancer and facing a potentially life-threatening illness changes a person's life in many ways, as well as their family and friends. While we've made much progress since I started as a chemotherapy nurse, unfortunately, some of the physical, psychological, social, and practical changes that occur are not always identified or addressed in today's healthcare system. We have more to do. As Julia Rowland, former NCI director of the Office of Cancer Survivorship, said, someone may be cancer-free, but still not be free of their cancer. We all must carry on Ellen's work and continue to listen and do better. I want to thank you again for this very important and meaningful award. Thank you.
Good evening. I am pleased to join NCCS in honoring the recipient of the Ellen L. Stovall Patient Advocate Award, my friend Kimberly Richardson. A leader pursuing an improved experience, enhanced information, and effective communication for cancer patients and survivors. Ms. Richardson is a two-time survivor of both ovarian and breast cancer, who has advocated for patients since her first diagnosis in 2013. She's the founder and organizer of Chicago's first Research Survivor Summit. She chairs the Survivor Committee of the Illinois Comprehensive Care Plan, and she's the co-chair to the Patient Advocacy Committee of the Society of Integrative Oncology. And she's recently been appointed to the Illinois House of Representatives to serve on the Special Commission on Gynecologic Cancer, which is part of the Illinois Legislative Black Caucus Health and Human Service Pillar. Ms. Richardson is known for her integrity, empathy, and fierce commitment to championing the patient's perspective. She uses her creativity to consider compelling ways to improve cancer patients' lives and shed light on ovarian cancer and the disparities among minority women. Her commitment to fighting more inclusive research, informing her community, and advocating for the concerns of women is proof that she is the embodiment of what is meant to be a fierce fighter for delivering quality care to patients here in America. Thank you, Ms. Richardson, for improving access, advancing equity, and working to bring forth equality in cancer care. Your work to bridge the gap between survivors, community, and research is saving lives.
In 2013, Kimberly Richardson was training for the Chicago Marathon, but she couldn't shake the unusual fatigue she was feeling. A visit to her doctor led to testing and the diagnosis of an ovarian cyst. She scheduled routine surgery to have the cyst removed, and when she awoke from the surgery, she heard the life-changing words from her surgeon that more than 17 million other Americans have heard. It's cancer. It was that diagnosis of a rare type of ovarian cancer and the initial negative interaction she had with her medical team that would propel her to become a fierce cancer advocate, ensuring that everyone touched by cancer has a voice in their own treatment.
Kimberly just oozes the passion of the work, and she lives and breathes it. She wants to not only bring her expertise and experience and her lived and professional journey, but also she has such a passion for sharing that with others to really inspire them to want to engage and partner with patients, families, and communities.
Initially, she was not an equal partner in her treatment decisions. It was a one-way conversation, with doctors simply telling her what she had to do, not welcoming her questions or her input. After her treatment, she knew that it was her life's mission to make sure patients have a voice in every aspect of cancer care.
What's clear is that patients should and want to be their own advocates for how they get treated and how their trajectory as a cancer survivor happens. But more often than not, they're being lectured to by the so-called experts. Yes, those experts understand cutting-edge cancer care. Kim really advocated to say that patient voices can elevate research, can elevate care.
Since her ovarian cancer diagnosis, she has worked tirelessly on her own and with many cancer advocacy organizations to make sure that researchers and physicians learn more about the needs and preferences of people living with cancer, to make sure patients have a voice, with a focus on the often underrepresented African American patients. She was selected to be part of the inaugural group of NCCS Elevate Ambassadors, a group of advocates working to improve survivorship care in their communities. That led to a partnership with the University of Illinois Cancer Center with the Survivors Advising Scientists Education Program, a bidirectional program that helps patients to better understand clinical research and helps doctors and researchers to better understand patient needs.
She's created these educational modules to really support MD, PhD students in engaging with cancer survivors and really bringing the community which the Cancer Center serves into that process. And she has made in really helping them to understand that that person in front of you has a story and has experiences, and that getting to know one another and really understanding that you're all part of that care team.
The students are so enthusiastic about this process. The feedback that I get from them is that they've learned so much and they want to bring what they learned from that patient voice into their clinical activities. It's made a big impression on them.
In 2020, while working tirelessly as a cancer advocate and raising her twin teenagers, Kimberly received her second cancer diagnosis. This time, it was breast cancer. A second cancer diagnosis in the middle of a pandemic didn't slow down her advocacy. It made it even more urgent. Kimberly is chair of the Survivorship Committee of the Illinois Comprehensive Cancer Control Plan and the co-chair of the Patient Advocacy Committee for the Society of Integrative Oncology. As the Illinois State Advocate Leader for the Ovarian Cancer Research Alliance, she has worked to create a commission in the state to ensure more research focuses on ovarian and other gynecological cancers. Through her advocacy work, she has been instrumental in helping to expand the effort to other states, always finding time to mentor others in the cancer advocacy community.
She's one of the most tenacious, hardworking advocates that I have ever seen. And she's a pioneer in the kind of work that she's doing. When someone says no, or she asks someone about, can we do this? Or can we have a survivor be involved in this? And they kind of push back. Like, Kim doesn't take no for an answer. And she's very inspiring in that way. She will use this platform and this award to continue a lot of the great work. She's a force to be reckoned with.
This is Congressman Danny Davis, and today I am talking about She Rose. Kimberly Richardson is an inspiration to many, especially to folks here in Chicago and throughout the state of Illinois. After surviving her own cancer diagnosis, Kimberly dedicated her life to lifting up the patient voice, educating her community about cancer, and improving outcomes for minorities, particularly Black women diagnosed with gynecologic cancers. I had the pleasure of witnessing the fruits of Kimberly's labor in 2020, when the Illinois House of Representatives Human Services Committee approved a proposed bill to create a commission to study gynecologic cancer, their impact on Illinois residents, and the most effective treatments. Here in Chicago, Kimberly organized Open Table, an event to inform the public about gynecologic cancer in the Black community. Her neighbors, friends, loved ones, and fellow cancer survivors are truly at the heart of her work. I'm grateful to Kimberly for her passion for patient advocacy, determination to change the future of cancer care, and her resilience as a cancer survivor. Congratulations, Kimberly, for receiving this prestigious honor as the recipient of the 2021 Ellen L. Stovall Award. Thank you.
I'd like to thank everyone involved in the Ellen Stovall Award, including the committee, the selection committee, the folks who nominated me this year for this award. I'm so grateful in so many different ways. And I wanted to really highlight most of the people that I've been involved with my patient advocacy. And I wanted to take the time to really thank them because they are so much a part of this award because they've given me so much great support and guidance. I want to take a few minutes just to say thank you to the Ovarian Cancer Research Alliance, because that's literally where I started in my patient advocacy with my very first diagnosis. I did a lot with them in terms of advocacy on the Hill, and I learned so much in terms of legislative advocacy, and I wanted to share that this award with them as well. In addition to the University of Illinois at the Cancer Center, Dr. Kidieski and his staff have been tremendous in supporting my work, particularly as I moved from legislative advocacy into research advocacy and started asking more questions about cancer research. And Dr. Kidieski and his staff were so supportive when I brought ideas, particularly that came from the NCCS Elevate program around teaching patients and caregivers and other patient advocates about cancer research. And so I'm incredibly grateful to the staff for giving me the support, the time, and the resources working with the MD PhD students on the Survivors Advising Scientists educational modules. I'm so grateful to the new patient advocates that I've met, largely Lisa Rice and Hillary Stiers, people who were very much a part of the nomination process. And a special shout out to Bridget Toomey, who I've known through Ovarian Cancer Research Alliance. She's been my roommate and my very close friend as we both do so much work for ovarian cancer. I wanted also to thank Hala Dara, who was someone that I've met this year. And we've done a lot more as COVID came through. We did a lot more on podcasts and interviews. And she really has been a person who was helpful in getting my voice out in terms of research advocacy. There are oncologists and researchers that I've had the opportunity to work with. And I'm so grateful to that, for that, because it's shaped my different perspective. When you come at this from a patient point of view, you only see things from your point of view. And to get involved with other oncologists and researchers have given me a broader understanding of what's really going on in cancer research. And so I'd like to thank Dr. Shannon McLaughlin, Dr. Anita Lee, Dr. Katie Kernett, and Dr. Joanna Burdett for showing me how wide we need to look at this lens of cancer and cancer research. There are other stakeholders that have been very instrumental in my development as a patient advocate, giving me the platform to speak. And those people are from WCG, Laurie Abrams and Steve Smith, as well as Alicia Staley, Pooja Merchant, and John Novak. These have been people over the last couple of years who have given me such a wide platform to not only learn from them, but to discuss things from a patient perspective, and it adds to their work as well. And lastly, of course, the politicians that I've worked with over the last couple of years on legislative issues, both statewide, Camille Lilly and LaShawn K. Ford have been instrumental in helping me get a special commission for gynecological cancer established here in the state of Illinois. And of course, my Congressman Danny Davis, who has always been an ally for all of the issues that we brought to him to the Hill, and has been involved in a lot of cancer caucuses and written several letters of support for us as we've always been on the Hill talking to him about ovarian cancer. And so these are just a few of the folks that I feel have been very instrumental in everything that have shaped my patient advocacy. But at the end of the day, it's all about NCCS and their opportunity that they gave me through the Elevate Survivorship program, Elevate Ambassador program, should I say. For a patient advocate to think through the issues that and the questions that they want to raise. Sometimes they want to raise those questions with their oncologists. Sometimes they'd like to know more information from researchers. And Elevate gave me that opportunity to write those ideas down on paper. And then I've actually gotten an opportunity, every single idea that I was able to do through Elevate, I've been able to see through fruition. So it feels like a full circle moment to be back with NCCS and accepting this award. And so I'm so grateful to Shelley and to Elena and to Lindsay and all the new staff that are on board. There's so much work to be done in patient advocacy. Research advocacy is so critical. We're making all these great strides, but we need to bring our patients and caregivers along with us. So I'm just very grateful for the award, and thank you to everyone who has supported me through this journey.
Good evening. I'm Laurie Isenberg, a member of the Board of Directors of NCCS. Tonight, I'm here in that capacity, but more importantly, as Ellen Stovall's cousin. The stories we've heard tonight remind us of why our work is so important. I can't help but think that Ellen would be so proud to see these two inspiring women receive an award with her name on it. Ellen was a young mother in her 20s when she was first diagnosed with Hodgkin's lymphoma. A decade later, after her lymphoma recurred, cancer survival was still not well understood. Ellen vowed that if she survived, she would dedicate her life to helping other survivors, ensuring those living with and beyond a cancer diagnosis were empowered to ask questions, gain information, and improve care. 35 years ago, NCCS changed the way we talk about cancer and launched the survivorship movement as we know it today. Our founders changed the language from cancer victim to cancer survivor. Ms. Richardson and Dr. Mayer exemplify both survivors and committed healthcare providers who significantly improved the healthcare system to make it more patient-centered for all of us. Tonight, we are so pleased to highlight the work of Dr. Mayer and Ms. Richardson through the Ellen Stovall Award. Your support of NCCS ensures that we can continue to recognize and share the stories of those who are making exceptional gains in patient-centered care. We can only continue this work with your support. Please consider joining me with a donation to the Stovall Awards tonight. It's easy to do, just follow the link on your screen. Your generosity allows us to continue the work that NCCS and Ellen started, supporting the more than 17 million cancer survivors today, and recognize and honor the work of individuals like Ms. Richardson and Dr. Mayer. Thank you so very much for your support.
Thank you, Laurie. And thank you to everyone who helped us to honor Dr. Mayer and Kimberly Richardson tonight, from the people who nominated them, the selection committee who chose them, and everyone who spoke tonight on their behalf. I also want to thank our incredible staff who made this event happen tonight. They are also hard at work preparing for our Cancer Policy Roundtable tomorrow, as well as all of our other programs. This year, we launched a new website, conducted and released the 2021 State of Cancer Survivorship Survey, and launched our new program, Survivorship Champions, all in addition to all of our other work. I like to say that we are a small but mighty staff. We rely on the support of people like you to do our work. If you've already donated, thank you. You can still donate using the link on your screen. The pandemic has highlighted to me the importance of gratitude. Through hard times, I'd like to remember all that I have to be grateful for. Tonight, I am especially grateful to Deb Mayer and Kimberly Richardson for their incredible contributions to cancer care and cancer survivorship, and to each and every one of you for joining us and supporting NCCS in our work. Thank you and good night.